All right, well, today, Dr. Scholz, we're talking about African American men and prostate cancer. So my first question is, how does screening change if a man is African American?
Well, the general feeling is that men who are African American and have prostate cancer have potential for having something a little more aggressive than Caucasian and Asian men, and that it can occur at a somewhat earlier age. So there's always been debate about what age to do PSA testing, and at one time in 2012, a task force even came out and said don't do any PSA testing in anyone. That was rescinded, thank God. So there's always been a concern about overdiagnosis, but there's a general consensus that men who are African American would be prudent to start testing at a somewhat younger age, maybe around 40. The numbers that are used for Caucasians are like 45 to 50. So maybe 5 years earlier if you're going to do PSA testing, which I would certainly advocate.
So what is it about African American men why do we need to start the PSA testing earlier?
There's a higher mortality rate, relative mortality rate compared to Caucasians for African American men. And the reason for that is not well understood, if it's understood at all. I mean, there's no doubt that African American society is somewhat disadvantaged, that they're not seeing as high quality physicians and they're not getting the same quality medical care. And that certainly could be a big part and maybe all of the difference between mortality rates. But there is also a suspicion that if you match stage for stage, grade for grade, that in African Americans, their cancers behave a little more aggressively. It's not a proven fact, but it is suspected.
Talking about PSA testing in general, we see a lot of African American men, when they get their test results back, they come back with higher PSAs. And so is that really due just to the way the medical system is set up at this point?
Yes, I think it's possible that the only difference between Caucasian and African American prostate cancer is that the diagnosis in African Americans is being delayed. And so we're just seeing the disease at a somewhat more advanced stage rather than it being an intrinsically different or more aggressive disease.
So getting into treatments, let's start with active surveillance. Is there a different protocol for a man who is African American as far as how he would interact with active surveillance as a treatment?
Well, there has been talk. If indeed one accepts that African American men have a more aggressive type of cancer, that maybe they shouldn't do active surveillance. That type of thinking has mostly been debunked. I think that the policies that are used for Caucasian men, if they're applied to African American men, will be equally effective. The one caveat is there's been some talk about African American men having cancers more toward the front of the prostate, which if you rely on random biopsies, which biopsies the back part of the prostate, conceivably might miss some of the cancers in the front of the gland. I've moved away from random biopsies 5 years ago, and we use multiparametric MRI, which sees the whole prostate. And so that would work equally well for Caucasians and African Americans.
Talking about further treatments, there are some drugs that work much better in African American men than maybe Caucasian or Asian men. Can you speak to that?
So in the advanced stages of prostate cancer, there have been some observational studies, database reviews and whatnot, that show better survival rates, for example, with an immune medicine called Provenge. And we're not talking about small differences. We're talking about maybe an extra year of life, an extra 2 years of life on average compared to Caucasians when Provenge is administered. That same pattern has been seen with other medicines for advanced prostate cancer, like Taxotere, a type of chemotherapy, or Xtandi, which is a second-generation hormone medicine, that those agents translate into better survival rates when they're used in African Americans than they do when they're used in Caucasians. And don't ask me what the explanation is for that. There's so many variables in these retrospective trials, it's really hard to imagine what is actually the reason for this, but these are observed findings in some retrospective database searches.
We talked about Provenge. Does Xtandi or any of the other hormone therapies work as well?
Yes, exactly. So that's it seems to be that agents that are shown to be effective in Caucasians for whatever reason, when we're talking about advanced metastatic prostate cancer right now, for whatever reason, are working even better in men who are of African American descent when they have advanced prostate cancer.
In your book, you talk about African American men having the same, I guess it would be risk factors as Caucasian men as far as their age when it comes to prostate cancer. So breaking it down, if a Caucasian man has he's 30 years old, he has a 30% chance risk of having prostate cancer. Is the same for African American men?
The incidence of prostate cancer is greater in African American men in addition to being more serious when it is diagnosed. So it's a combination of greater frequency and increased risk of early mortality.
When it comes to us in the prostate cancer community, as we see that a lot of African American men are not getting their PSA checked, how can we go about basically spreading awareness, talking to family members? Like, what can we do in order to help these men get checked?
Well, I think it's a two-step process. One, as you mentioned, just awareness, family awareness, people speaking in churches and reminding people. It's a simple blood test once a year. I think the second step is educating people so that they're not fearful of what's going to follow. People are well aware of the fact that if they have prostate cancer, it's possible that they'll be encouraged to have a mutilating form of surgery that's going to take away their sex lives. And that obviously is incredibly unpopular. And one solution is just to not even go there. So we have to somehow recapture the confidence of African American men that there are non-invasive ways, active surveillance, focal therapy, that can control the prostate cancer, save their lives, and still allow them to retain their sex lives.
Thank you so much for watching. If you would like more information about anything that we talked about today, you can visit our website at pcri.org. Also, subscribe to our YouTube channel and give us a thumbs up on this video. We come out with new prostate cancer videos every single week. We hope you have a great time.